Welcome back to Book Podcasters. Hey, you made it through another week. Seriously, give yourself a pat on the back.
Yeah, definitely.
Feeling like your brain's just, doing mental gymnastics, trying to learn everything.
Oh, absolutely. We've all been there.
Especially if you're juggling coursework and, well, life. It's a lot.
It really is.
So today we're grabbing hold of Chapter 18. It's all about cognitive therapy, or CT. Think of it like learning to rewire those internal thought gremlins, reshaping our minds to actually influence how we feel.
Exactly. And the really cool thing about cognitive therapy, I think, is it's built on this really practical idea. What we think. It isn't just background noise.
Right.
Our thoughts actively sculpt our emotions. And those emotions, well, they heavily influence our actions.
So our mission today, let's dive deep, understand how those automatic, sometimes really sneaky negative thoughts can take root.
Yeah, and crucially, how we can learn to challenge them. Cultivate a more balanced inner dialogue.
Right. And just to get us started with a solid foundation, our textbook, Townsend, puts it really well.
How does it define it?
It says, cognitive therapy focuses on what's happening right now and aims to tweak those thinking habits that aren't really serving us.
Especially when they contribute to psychological hurdles.
Exactly. Those hurdles we all face sometimes. Okay, so let's really get into the nitty-gritty now. What does cognitive therapy actually look like in practice?
Well, at its heart, it's about spotting that link. It's often overlooked, but it's super strong.
The link.
Between our unhelpful or, negative thinking patterns and those feelings of distress, or maybe behaviors that aren't getting us where we want to be.
Okay.
Imagine your mind is like a garden, right? And negative thoughts are like weeds.
Ah, okay. I like that.
If you don't address them, they can really take over.
Yeah.
Crowd out the good stuff.
Those mental weaves. That's a great way to put it. And to make this less abstract, let's talk about Sarah. She's 28, struggles with feeling insecure in relationships, and it seems to stem from this deep belief.
What's the belief?
If people really got to know the real me, they'd eventually leave. That's a tough one to carry around.
Oh, absolutely.
Yeah.
That would definitely color her interactions. And what cognitive therapy helps Sarah do is identify this thought as what we often call an automatic negative thought, an ANT.
An ANT. Okay, like the insect?
Sort of. They're called automatic because they tend to just pop up, often without us even consciously noticing.
Sneaky.
Very. And yet, they can pack a real emotional punch. So through a process called cognitive restructuring,
Okay.
Sarah can learn to actually examine that thought, question its validity, and ultimately challenge it.
So it's like becoming a mental exterminator, catching those ANTs before they throw a huge negativity party in your head.
Yeah, something like that. Bit less aggressive maybe, but yeah, identifying and dealing with them.
Okay, so what are the core principles that make this whole thought remodeling thing actually work?
Well, there are several key ideas. The first big one is understanding cognitive distortions.
Cognitive distortions, okay.
Think of these as those illogical or irrational patterns in our thinking that tend to amplify negative emotions.
Like mental glitches.
Exactly. Little mental glitches that skew our perception of reality.
Okay, give us some juicy examples. My brain definitely has its go-to dramatic scripts sometimes.
Oh, we all have our mental soap operas. One really common one is overgeneralization.
Overgeneralization.
Right. This is when you take one negative event
Yeah.
and just draw this huge sweeping conclusion like it's going to happen in all similar situations.
So you fail one quiz.
And your brain shouts, see, you always fail at everything. It's like reading one bad restaurant review and deciding you'll never eat out again, ever.
Yeah. The mental equivalent of stubbing your toe once and deciding you can never walk again. So dramatic.
Exactly.
What other mental tripwires should we look out for?
Then there's catastrophizing.
Ooh, sounds bad.
It is. This is where you take a relatively minor issue and just blow it completely out of proportion. You imagine the absolute worst-case scenario playing out. Like, you don't hear back from a friend right away, and suddenly you're thinking, they must be furious. Our friendship is over. I'll be alone forever.
Oh, yeah. I've definitely written that doomsday screenplay in my head more than once. Guilty. And the last one you mentioned.
That's all or nothing thinking, also called black and white thinking.
Yeah.
This is that rigid view where things are either perfect or a complete disaster.
Yeah.
There are no shades of gray allowed.
Example.
If I don't get an A on this paper, I'm a total failure as a student.
Wow. Talk about setting the bar impossibly high.
Right. And then feeling like you've completely face-planted if you don't clear it perfectly.
Sounds incredibly draining. So, okay, if these are the common mental missteps, how do we actually fix them.
But that's cognitive restructuring, right?
Exactly. Cognitive restructuring is the active process. You identify those unhelpful thoughts, you examine the evidence for and against them.
And then you consciously work to replace them with more balanced, realistic, and ultimately more helpful ways of thinking.
It's like training a muscle then.
Yeah, that's a great analogy. The more you practice challenging those old thought patterns, the stronger your ability becomes.
So it's not just about like slapping on a happy face and pretending everything's fine.
Not at all.
Yeah.
No, it's about striving for accuracy, for a balanced perspective. As Townsend emphasizes, CT empowers you to identify, scrutinize, and reframe those negative thoughts.
Which leads to
Emotional relief, and it fosters positive changes in behavior. It's about cultivating a more rational and supportive inner voice.
Okay, that makes a lot of sense. So we've got a handle on what CT is, the principles. What about the actual techniques, the tools a therapist might use in a session?
Right. Well, one of the cornerstone techniques is Socratic questioning.
Socratic questioning. Sounds intense, like Plato's gonna pop quiz me.
No, don't let the name intimidate you. It's not about the therapist interrogating the client at all.
Okay, good.
Instead, it involves the therapist asking these thoughtful, open-ended questions.
To guide the client.
Exactly. To guide the client to explore their own thoughts, their assumptions, their beliefs, leading them to their own insights. Those aha moments.
So the therapist is more like a guide on the side, helping the client connect the dots themselves. What kind of questions are we talking about?
Well, prime example might be asking, what evidence do you actually have to support that thought?
Simple but powerful.
Or what might you tell a friend if they were having the exact same thought?
Oh, that's a good one. Shifts the perspective.
Right. These kinds of questions encourage the client to just step back from their immediate gut reaction and look at the situation a bit more objectively.
It's like becoming your own thought detective. Gathering clues, analyzing the evidence. I like it. What's another key tool?
Thought records. These are incredibly valuable.
Like a diary for your thoughts.
Sort of, yeah. They're essentially structured journals or worksheets. Clients actively write down their negative thoughts, along with the situation that triggered them and the emotions they felt. Then, and this is crucial, they examine the evidence, both for and against that initial thought.
Right. Got to see both sides.
Definitely. And finally, they work on developing more balanced, alternative ways of interpreting the situation.
So it's a really tangible way to take those swirling, often overwhelming thoughts out of your head and dissect them on paper.
Precisely. It makes them less floaty and more concrete.
And then, bringing it all together, we have cognitive restructuring again, but this time as the action step.
Exactly. Once those unhelpful thoughts have been brought into the light, examined using tools like thought records and Socratic questioning,
Then what?
then cognitive restructuring is the active process of challenging those thoughts directly, consciously replacing them with more realistic, adaptive, and ultimately less distressing ones.
So that's okay, now that I see this thought isn't entirely accurate, what's a more balanced way to think about this part?
You got it. That's the reframing piece.
You mentioned a real-life application earlier. Could you walk us through that again, just to see how it all fits together?
Sure. Let's take someone who gets really anxious before, say, giving a presentation.
Okay, common scenario.
Their thought record might reveal a recurring thought like, I'm going to completely freeze up and make a fool of myself in front of everyone. Classic catastrophizing, right?
Totally.
So the therapist would then guide them through examining the evidence.
Like asking.
Have you always frozen up in past presentations? What preparation have you done for this one? What are your actual strengths as a presenter?
Getting specific.
Exactly. Through this questioning and evidence gathering, they might start to develop a more balanced thought. Something like,
Like what?
okay, well, I might feel nervous, yeah, but I've prepared well. And I have managed presentations successfully in the past. Even if I stumble a bit, it's probably not the end of the world.
Wow, that's a huge shift.
Yeah.
From total fear to, well, realistic self-assessment. Grounded.
That's the goal. More grounded, less driven purely by fear.
Now, let's really dig back into those common cognitive distortions. We touched on them, but let's break them down more. More examples, and importantly, practical ways to challenge them.
Okay, sounds good.
Let's start with overgeneralization again, the I always fail one. How do we start to untangle that absolute statement?
Right. The key here is to become a detective, but for counter evidence.
Looking for proof it's not true.
Exactly. We'd encourage the person to specifically recall past successes, even small ones, instances where they've shown improvement.
So breaking the power of that always.
Precisely. Find concrete examples that prove it's not entirely true. Maybe they didn't ace every part of that last project, sure, but they got great feedback on one specific section. That's evidence against always failing.
Okay, makes sense. Hunting for the exceptions. What about all or nothing thinking? That if I don't get this job, my career is over thing. Feels so final.
It does, absolutely suffocating. The way to challenge this is to help the person see the situation as more of a spectrum.
Not just two extremes.
Right. Not getting this specific job doesn't automatically mean their entire career is doomed. There are likely other opportunities, different paths, skills they can develop.
So opening up the possibilities again?
Yes, recognizing the many possibilities that exist between those two stark extremes of perfect success and utter failure.
That definitely takes some pressure off that one single outcome. Okay, next up, catastrophizing. If I miss one social event, I'll be completely alone forever. Wow.
Yeah, incredibly isolating and dramatic, isn't it? To challenge this, we need to gently explore the actual probability of that extreme outcome.
Like, really? Forever alone from one missed party?
Kinda, yeah. What's the real evidence that missing one event leads to complete and permanent social isolation? We'd also encourage them to think about less extreme possibilities.
So such as?
Maybe some friends will miss them, sure, but they'll likely catch up another time. And we might ask them to recall past instances where they missed events, what actually happened. Usually it wasn't the catastrophe they imagined.
Right, bringing them back to reality. Okay, and finally, personalization. It's my fault that the project didn't succeed. This one feels tricky. Like, taking responsibility is good.
Right, it is. But this is often about taking too much or inappropriate responsibility.
Oh, okay.
So the challenge here is to encourage the person to consider other contributing factors, alternative explanations.
Like what? External stuff.
Exactly.
Huh.
Were there market changes? Did other team members face challenges? Was the initial plan maybe unrealistic? It's about moving away from assuming sole blame towards a more balanced understanding of cause and effect.
Makes sense. Seeing the bigger picture.
Yeah.
You mentioned a therapy session example earlier. A client says, I can't do anything right. How does a therapist start to gently push back on that?
Well, the therapist would likely start by gently questioning the absolute nature of that statement. Anything, really, not one single thing.
Challenging the all or nothing part of it.
Precisely. They might ask, can you think of even one small thing you've done reasonably well recently? Or, if your best friend told you that, what would you say to them?
Turning it around again.
Yeah. The goal is to help the client identify even tiny pieces of evidence that contradict that sweeping belief. To start recognizing patterns of competence they might be totally overlooking because the negative filter is so strong.
It's like planting little seeds of doubt in that big negative story.
Exactly. And then helping them find the evidence to water those seeds.
Okay, great. Now let's shift gears a bit. How does all of this apply in the practical world of psychiatric nursing?
Oh, it's hugely relevant.
Yeah.
Cognitive therapy has shown remarkable effectiveness for a whole range of mental health challenges.
Like what specifically?
Well, as Townsend highlights, it's really valuable for depression, various anxiety disorders, eating disorders, even OCD.
Okay.
And in psychiatric nursing, nurses are often right there on the front lines. They play a vital role in supporting this whole therapeutic process.
So maybe nurses aren't leading the full hour-long CT sessions, but they're actively involved, helping patients apply these ideas.
Precisely. Nurses often act as crucial allies. They work collaboratively with therapists, helping patients identify and start to challenge those negative thought patterns we've been talking about.
Reinforcing the skills.
Yeah, reinforcing concepts learned in therapy, helping patients practice applying them in their everyday interactions, especially within the healthcare setting itself.
You gave a clinical example earlier, a nurse talking to a depressed client. How might that actually sound using CT principles?
Well, a nurse might gently ask a client who's feeling hopeless. Something like, what's the evidence that things will never get better?
That simple question.
It can be incredibly powerful. It prompts the client to start questioning the absolute certainty of their negative outlook, to consider even the smallest possibility of positive change. It's about opening just a tiny window of hope sometimes.
That's subtle, but potentially really impactful, just starting that questioning process. What are some other practical nursing interventions that draw on CT?
Well, nurses, through their regular assessments and just chatting with patients, are often in a prime position to notice those telltale signs of cognitive distortions.
Like the black and white thinking.
Exactly, or frequent catastrophizing. They can then use basic cognitive restructuring techniques very gently to suggest alternative more balanced perspectives.
Can you give an example?
Sure. If a patient says, this medication isn't working perfectly, so it's completely useless, a nurse might gently counter with something like, okay, it sounds like it's not giving you complete relief yet, but have you noticed any small improvements at all? Maybe sleeping a bit better.
Ah, looking for the gray area again.
Right. And encouraging patients to keep a thought journal can also be a really valuable nursing intervention. It gives them a space to record thoughts and feelings for later reflection, maybe to discuss with the therapy team.
So nurses are really on the ground level helping patients take those first steps, recognizing and reframing thoughts.
Mm.
Okay, let's tackle something that often confuses people. The difference between cognitive therapy, CT, and cognitive behavioral therapy, CBT. People use them interchangeably all the time.
Ah, yes. That's a really important distinction to make. They are closely related, they share core principles, but the main difference is really in their scope.
Okay, scope how?
Cognitive therapy, CT, as we've been focusing on, primarily targets identifying and modifying those cognitive distortions, the thought patterns themselves, to get emotional regulation and behavior change. The main lever for change is the thought.
Got it. So the central focus is really on understanding and changing those internal thought processes.
Exactly. Now, cognitive behavioral therapy, CBT, takes a broader approach. It's more action-oriented, you could say.
How so?
It absolutely incorporates those cognitive restructuring techniques we've talked about. Challenging thoughts is still key. But CBT also integrates a range of specific behavioral interventions.
Behavioral interventions like?
Things like exposure therapy, activity scheduling, relaxation techniques, skills training. It addresses both what's going on inside your head and how you're actually behaving in the world.
Okay, so CT equals mostly internal thoughts. CBT equals thoughts plus outward actions and behaviors.
That's a good way to summarize it.
Huh.
CBT actively brings in those external behavioral elements to create change alongside the cognitive work.
Can you give us a clear example to really nail that difference?
Sure. Let's take our example of someone with social anxiety again.
Okay.
In pure CT, the main focus would be identifying and challenging those anxious thoughts. Everyone will think I'm boring, I'll say something stupid.
Right, changing the thinking.
In CBT, they would still address those thoughts using cognitive restructuring, absolutely. But they would also incorporate practical behavioral exercise,
Like what?
like creating a hierarchy of feared social situations. Maybe starting small, making brief eye contact with a cashier, and gradually working up to more challenging things, like initiating a conversation. It involves behavioral experiments.
Ah, so gradual exposure, practicing in the real world.
Exactly. The idea is to not only change the thinking, but also to build confidence in new behavioral patterns through actual experience, testing those negative predictions.
That makes the distinction much clearer. CBT is like CT plus homework assignments involving real-world practice.
Kinda, yeah. Practical application is a big part of CBT.
Okay. Before we wrap up, what about ethical or cultural things to keep in mind with CT?
Really important points. First off, informed consent is crucial. Clients absolutely must understand the process, what's involved, and agree to participate actively.
Makes sense. They need to be on board.
Definitely. And cultural sensitivity is huge. Thoughts, beliefs, interpretations of events, these can vary significantly across different cultures and backgrounds.
So a thought that seems distorted in one culture might be perfectly normal in another.
Potentially, yes, or at least understood differently. Nurses and therapists need to be really respectful of these differences and avoid imposing their own cultural assumptions. As Townsend points out, CT requires a truly collaborative relationship. The client's active participation and perspective are key.
Can you give an example of how culture might intersect with CT?
Sure. Imagine working with a client from a more collectivist culture, where family well-being is highly prioritized. They might feel an immense sense of personal responsibility, maybe even guilt, if a family member is struggling.
So a thought like, it's my fault my sibling isn't succeeding, might be tied to cultural values.
Exactly. A therapist needs to understand the influence of those cultural expectations on the client's thoughts about failure or responsibility. The goal isn't to dismiss the cultural value, but maybe to help the client develop healthier perspectives within that context, distinguishing between appropriate concern and, perhaps, excessive self-blame.
That requires a lot of nuance and understanding.
It really does. Collaboration and cultural humility are essential.
Well, this has been a truly insightful deep dive into cognitive therapy. It's really amazing to see the power of understanding and learning to shift those thought patterns.
Absolutely. They can have such a profound impact on how we feel and act every single day.
It really feels like it's about empowering people, doesn't it? Giving them tools.
Definitely. Empowering individuals to become more aware of their own internal mental processes and equipping them with practical tools to navigate those internal landscapes in a more constructive and hopefully more self-compassionate way.
So if you're listening and feeling maybe overwhelmed by those persistent negative thoughts, remember that just becoming aware of them, that's a really powerful first step.
It really is. Awareness is key.
You absolutely have the capacity to learn and grow, and even small, consistent efforts to just examine and maybe gently adjust your thinking, they can lead to really significant positive changes in your overall well-being.
It's a process, not an overnight fix.
Totally. So take a deep breath. You've got this. Seriously, you're learning and growing every day, even when it feels tough. Keep that in mind.